So imagine being 9 years old and you have a younger sister who's 6 and she's been sick for over a week and she was diagnosed with strep throat, but after taking the antibiotics, she's still not getting any better. So your mom decides that she's going to rush her to the hospital, and when she gets there, she tells the doctors that her breath smells like alcohol, but she has not obviously had anything to drink. So they take her to the back, and shortly after they come out and they say, your daughter has type 1 diabetes, and her blood sugar was actually over 1,000, and for a normal person it's supposed to be between 80 and 180. So she was close to being into a coma, and she was rushed to a different hospital. Initially, when we started to tell people, my sister was diagnosed with diabetes, they were like, well, what could you have done to prevent it? They thought it was my parents' fault. There's a lot of myths that people, there's a lot of reasons that people think diabetes is caused, but it's actually not exactly preventable. A lot of people think that there are things you can do to prevent it, and it doesn't have to do with sugar or your diet. There are other types of diabetes that are caused by too much sugar in your diet or obesity, but type 1 is not one of them. And type 1 diabetes is actually when your pancreas just completely stops producing insulin, and it's something that happens internally. It's when your body's immune system attacks its own cells, so specifically the cells that produce insulin in the pancreas. And there are some people that are more at risk than others, like children whose parents do have diabetes. And also, according to Gallmer, Caucasians actually have the highest correlation with diabetes over any other race. Some of the symptoms of diabetes include urinating more often, dehydration, and fatigue. A lot of people are weak and lethargic, and that's one of the main things you see. And a lot of people also get like blurry vision or weight loss. And because there is no cure for diabetes, it requires a very special treatment. One of the treatments is insulin injections. So like here I have a syringe. You can use this to inject insulin into your body, either in the arm, the stomach, the thighs, or the buttocks. So you just basically put this into a bottle and drop the insulin. You can inject it that way. And there's also a different kind of injection that's called a pen, and you dial up the insulin. It's like inside the pen, and you use these two little needles. Well, use one at a time, and you can inject them into any of the sites I named. And then there's also a more advancing technological option, and it's the pump. And according to the American Diabetes Association, the pump is better because it's more rapid, it releases more rapidly the insulin, and it's more precise, and it's safer for kids. But there are downfalls of it because it is on the outside, it's not very private, it's attached to your body like at all times. So it can be dangerous in that sense. It can be ripped out or things like that, but it's all computerized. And the amount of insulin that you actually inject into your body depends on your blood sugar reading, your blood sugar level, and the amount of food you eat. So to check the blood sugar, you actually just prick your finger and take a little bit of blood, and then the meter will read it. And like I said, a normal person's blood sugar should be between 80 and 180. And if your blood sugar is above 180, you inject insulin. And if your blood sugar is below 80, then you have to eat or drink something with sugar in it. So like a juice box or snacks. And then recently, my she's 17 now, she's had diabetes for 11 years. And just recently she had a really bad low blood sugar, and when someone's blood sugar goes too low, you can become like unresponsive or unconscious, and that's what happened to my sister. So my mom actually had to use a glucagon pen, which is the opposite of insulin. It injects sugar or glucose into your body. And though it is sometimes painful, or like a pain to treat diabetes, a person with diabetes can live a normal life. A lot of people, a myth about the diet of a diabetic is a lot of people think you can't eat foods with sugar ever, and that's false, because you can eat sugar. It just has to be monitored how much sugar you're eating. And according to the American Diabetes Association, portion control is key. So as long as you monitor how much sugar you're intaking and you can treat it accordingly, you can have sugar. Another thing is people think that diabetics can't play sports because it is a big risk. And it also just goes back to monitoring your blood sugar levels. And a way to prevent low blood sugar during sports is to lower the dosage of insulin before you start playing sports. Also, having a sister with a teenager, alcohol comes up as a topic, and it's best for diabetics to not drink any alcohol at all, but if they do, it's just recommended that they only have one, because alcohol can obviously cause you to think differently or not think straight, and as a diabetic you need to know how much insulin you're putting into your body, you need to know your blood sugar level, and alcohol can cause like fluctuations in blood sugar levels. And according to Childs, alcohol can stop the liver from releasing glucose, and that leads to low blood sugar. And your liver is trying to deal with the alcohol, and it can't deal with the alcohol and release glucose at the same time, so it causes a lot of problems. But in conclusion, diabetes is a serious disease, and a lot of the myths about how it's caused and treated are false, and diabetics can definitely still live a normal life. And I hope you all are better informed now, and if you ever come across someone in your life, whether it be a family member or a friend or a teammate, you can recognize the signs of diabetes and be able to help them out or treat diabetes. So I hope you all learned something, and thank you for watching.